तो पहला और एक रात और एक दिन पहले ये नहीं होता इस तरह रो रहा सी और पेट फुलिया सी कि यानी सांस लेने बहुत औखा सी उस तो बाद फिर जी उन्हें एक सिर च भी यानी कोई नालियां वगैरह लाइया सी और उस नक च भी उस तो बाद यानी उन्हें क्या भी खून भी देना चाहिए खून लाया फिर जी खून लाया फिर खून भी और ऑक्सीजन भी उन्होंने लाई उसे ते आवाज आई बच्चा फौत हो गया मैं यकदम उठाया उदो मैंने किसी भी नहीं उठाया मैंने आवाज ही इस तरह महसूस हुई मैं कहने नहीं मेरा बच्चा नहीं हो सकता मैंने इस तरह यानी तसल्ली से भाई आपने आपने तसल्ली देने वास्ते नहीं मेरे बच्चे मैं उत्थे बिस्तर जो कुछ उत्थे छड़ के बच्चे आल गया थे बस फौत
The doctor who treated him was Professor Tariq Bhutta, head of pediatrics at Nishtar Hospital. He was about to make a disturbing discovery.
We noticed a very peculiar phenomenon that we were getting very small babies, most of them between the age of 3 to 6 months, who were coming with history of diarrhea, but at the same time they were having very severe abdominal distension and their intestines were absolutely silent, not functioning at all. And when we went through the history, we found that all of them had one thing in common, that they were given a drug which is an anti-motility drug. In other words, it stops the intestinal movement completely. The commonly used drug is Imodium drops. It's available in the form of drops, it's available in the form of liquid syrup, and it's also available in the form of capsules. But in small babies, it's used mostly in the form of drops, but the drops are so concentrated that 1 milliliter of this drop is equal to 1 capsule.
Pakistan's Imodium is made in Karachi by the massive multinational Johnson & Johnson under license from Janssen of Belgium. Within 10 years, Imodium became the best-selling anti-diarrheal drug in the world. And in Pakistan, with millions of bouts of diarrhea in children each year, an enormous market.
It's used commonly in adults, in which it doesn't cause any problem. But in small babies, it is not to be used because it is really dangerous. And in this country, this is very freely available. There are many drugs, anti-motility drugs, which are available in the country. But this particular drug is very, very strong and can, with 1 or 2 doses, can cause complete stoppage of the intestinal function. The result is that the child starts getting abdominal distension, and this sometimes can kill the baby.
Back in 1980, the World Health Organization said of anti-diarrheal drugs, they are dangerous in children and they should never be used. Johnson & Johnson's specification, Imodium drops in Pakistan should not be given to babies under 12 months, and its use outside the prescribing information is beyond their control. But in Pakistan, that's the problem.
In our country, literacy rate is very, very low, particularly amongst women, and more particularly amongst women coming from the rural areas. They can't read Urdu, they can't read English, they can't really follow the instructions which are given. So these instructions which are given in the literature, in the along with the formulation, is really meaningless as far as an ordinary family in Pakistan is concerned.
In Britain, Johnson & Johnson make available detailed precautions and warnings about Imodium and its side effects, far more than in Pakistan.
The only side effect which is mentioned in our country is that it may cause dry mouth. So when people are not given the correct information about the danger of drug, and the only danger said to be is dry mouth, then of course people will use it thinking it's a very safe drug, so they can use in any amount. In UK, it is not available in the form of drops at all. And there, the company does not recommend its use below the age of 4 years.
The UK limit is set by the government. In Pakistan, the age limit is much lower. The advice, not to administer Imodium to infants under 12 months.
And they also say that this is also for symptomatic relief of the diarrhea and not a cure of diarrhea. So if you have only a drug which gives symptomatic relief, it should be absolutely safe, particularly for smaller babies where it can cause greater damage.
It was a doctor who gave Jamila and Abdul Hafiz Imodium drops for their 2-month-old son.
ਹਾਲਤ ਇਹ ਸੀ ਬੱਚੇ ਦੇ ਮੂੰਹ ਜਿਹੜੇ ਹੁਣ ਸਨ ਉੱਤੇ ਜਿਵੇਂ ਨਹੀਂ ਸੁੱਕ ਨਹੀਂ ਜਾਂਦੇ ਇਵੇਂ ਸੁੱਕ ਗਏ ਸਨ ਬੱਚੇ ਵਿੱਚ ਸਖਤ ਮਾਲੂਮ ਹੋਣ ਲੱਗ ਪਿਆ ਸੀ ਪੇਟ ਵੀ ਆਪਰਿਆ ਹੋਇਆ ਸੀ ਫਿਰ ਅੰਦਰ ਉਹਨਾਂ ਨੇ ਨਾਲੀ ਲਗਾ ਕੇ ਨਾ ਤੇ ਅੰਦਰੋਂ ਬਈ ਜ਼ਹਿਰ ਜੀ ਨਿਕਾਲਣੀ ਸ਼ੁਰੂ ਕਰ ਦਿੱਤੀ ਤੇ ਫਿਰ ਬੱਚੇ ਦੇ ਬਸ ਜ਼ਰਦ ਰੰਗ ਹੋ ਗਿਆ ਸੀ ਪੀਲਾ
पहले पेट आफरिया नहीं सी है बिल्कुल दूसरी कतरे पिलाए सन तो 2-3 घंटे बाद इनकी गैस पैदा हो गया पेट बिल्कुल फुल हो गया
तो बस ये होंगे जिवें बच्चे होंगे ना भी तकलीफ होंदी है तो बस ये होंग सी पता लगदा सी होंगे ना हालदा सी ना बाजू लांदा सी ना लत्तां कोई चीज़ भी नहीं सी लांदा सिर्फ होंग होंगे किसी तो जिसले फौत होया बस होंग बंद हो गई।
Johnson & Johnson say Imodium drops are intended for use under medical supervision. But in Pakistan, that's virtually impossible. The outpatients department of every hospital is overflowing. The system can hardly cope with the demand for treatment and drugs.
People are very much drug-minded. A lot of people like to give drug or want drugs for every symptom or every disease. And diarrhea is also one of them. And a lot of children get unnecessary drugs which can not only be useless but sometimes even fatal to these children.
Drugs are also dispensed by local GPs and quacks. The doctor's income comes not from the consultation, but from the medicines he sells. A system which encourages the overuse of drugs. Johnson & Johnson say Imodium drops have prescription status in the third world. But in Pakistan, drugs are available over the counter. 30,000 chemists sell 9,000 different drugs. Prescriptions hardly exist.
We are supposed to keep the prescriptions with us, and the drugs and medicines are supposed to be dispensed on the prescription of a registered medical practitioner. But it is not the practice. The practice is that the self-medication is the biggest problem in the health system of the country. People are buying drugs just like they are buying fruits and candies from the shops. So the customers, they come and they ask for any medicine they want.
If they should be available under the prescription, then they should not market it in a country where there is no prescription. In India, Bangladesh, Pakistan, many other third world countries, the drug purchase is not controlled by prescription. If they know it, then they should not market it.
Each week after Friday prayers, Nasen and her husband visit the grave of their son, Nadeem.
याद ही नहीं आंदा अपने बच्चे याद भूल दे किस टाइम याद भूल दे जिस टाइम बहु खाऊं पीऊं उस टाइम याद आने कि उन्हें खवाऊंगा उन्हें पिलाऊंगा चाहूंगा अपने बच्चे तो याद नहीं भूलता किवें याद भूले
Nasen had bought Imodium drops for her son when he got diarrhea. The doctor thought they were safe. Nadeem was 2 years old, well outside Johnson & Johnson's age limit in Pakistan.
निस्तर वे ते थुला गए उन्हें बोल चल खावन पियन बंद है पेट फुला होया इन्हें पेट निस्तर के उन्हें फुला होया रिया पिया खाई दिस कोई चीज ना वो लेंदे रहे बोतल साल में बाजू में बदन फूल गया उन्होंने भाई राग की थाई ना लबी बोतल ना ला सकी उन्हें इतने चीरा दीता चीरा दे के बाद निस्तर ले बोतल ला रात में उठे बोतल लगी रही सवेरे जेड़ा है बस 4 दे टाइम है ये लोग ठीक है
Professor Bhutta was concerned. Over the next 4 months, he recorded the cases of Imodium intake.
Well, we received from November till today something like 21 cases. And out of those 21 cases, 7 have died. And all have died as a direct result of Imodium. I would call it Imodium poisoning, because they suffered from the same symptoms and they suffered from the same problems as others. Majority of them were below the age of 1 year. Some of them were as young as 1 month old. The oldest was about 2 years.
Professor Bhutta was alarmed. His patients appeared to be dying from a drug that had been given to treat them. He alerted Johnson & Johnson.
It was first week of December, when I wrote to the company in Karachi that we are seeing these deaths and complications as a result of Imodium, and I hope that you withdraw this drug before it can kill many more children in the country. But unfortunately, I did not receive any reply from them for nearly 2 months. In the meantime, we got our data together, and I sent my observations to the Lancet in London.
12 days before it was published in the Lancet, Johnson & Johnson replied to Professor Bhutta. The pharmaceutical industry does not have any control on misuse or overdosage.
They are trying to say that most of these cases who have died should not have been given the drug. And that is precisely what I am saying, that this drug should not have been made available, particularly in this formulation of drops, because when you make drops, it's basically for small babies. You don't make drops for adults. For that, they already have capsules.
Although Johnson & Johnson said they could not be responsible for misuse, the letter continued, in order to prevent possibilities of reoccurrence of misuse of Imodium in babies and small infants, we will discontinue the manufacturing of Imodium drops. But the letter did not say when they would stop manufacture, nor did it promise to withdraw the drops already on the market.
It was only when my letter got published in Lancet that they moved quickly, because the general manager of Johnson & Johnson, he wanted to come over to see me, and he promised that he is going to stop the production of the drug, but for that he needs the permission of the government of Pakistan. I said, if you don't get the permission for the next 6 months, you will keep producing the drug. Well, he said, no, we'll stop it as soon as possible. And but again, when I mentioned that what about those drugs which are already in the market and will be responsible for killing many more children, he was not very sure what he is going to do about it, because he thought it's very difficult to withdraw all the bottles from the market. I think what he was really scared was to make it a public issue. So when I insisted that he should withdraw all this, he promised that he will ask his distributor to ask the chemist to return those bottles.
Almost 3 months had now elapsed since Professor Bhutta first alerted Johnson & Johnson to the problems with Imodium. Imodium was still on the shelves, and Professor Bhutta's warning that more babies would die if the drug was not withdrawn was about to become a reality. Faisal Rashid was brought to Nishdar Hospital in the early hours of February the 26th. He had been given Imodium drops. 3 drops every 4 hours. Faisal had been given an overdose. Faisal died at 3:25 the following morning. He was the first child after 14 years of marriage. He was 33 days old. His body was returned to his grandmother to take home for burial.
When I got my last patient who died as a result of it, I again wrote to the company that, look, this drug is still available and it is still killing children. It is still causing problems. So why don't you withdraw it throughout the country immediately through the help of your field force or the distributors?
Johnson & Johnson replied 4 days later. I wanted to inform you that after the necessary permission from the government of Pakistan, we have begun withdrawal of Imodium drops from the market and have come to know that most of the drug from the Multan market has been collected by our field force. The bazaar in Multan and the availability of Imodium drops is being checked by one of Professor Bhutto's doctors.
Imodium drops हैं, एक दे दें.
एक Imodium drop है.
Imodium drops हैं.
4 days after Johnson & Johnson had assured Professor Bhutto that they had effectively removed Imodium drops from the Multan market, he was able to buy them from 5 of the 6 chemists he visited. For the next 2 months, Imodium drops could still be bought at 60% of chemists visited in Pakistan's major cities. By late May, 25 out of 30 chemists in the capital, Islamabad, were still selling Imodium drops.
As long as the last bottle is still available in the market, it's going to be a danger. I'm not really waging a campaign. I'm just trying to save the children against these dangerous drugs, which, if not stopped, might keep killing many more.
It appeared that what Professor Bhutto had uncovered in Multan could be happening all over the country.
आमिर, उधर से भेजो नबील वगैरह किसी को. उधर से मुनीर को या इम्तियाज को किसी को जल्दी से भेजो. क्या नाम बोल?
In another hospital, Qasim was brought in, suffering from a suspected overdose of Imodium. He was 25 days old.
इस बच्चे को जो दवाई दी हुई थी डायरिया के जुलाब के दौरान, दस्तों के दौरान उसको दवाई दी हुई थी, वो कतरों के फॉर्म में थी, जिसको हम लोग इमोडियम बोलते हैं इंग्लिश के. तो उसका पेट फुला हुआ था और बच्चा रुक रुक के सांस ले रहा था. इसको माँ से हम लोगों ने पूछा, उन्होंने हमें बताया और उसको बोतल दिखाई, जिससे उसने बताया कि ये दवाई दी हुई है बच्चे को.
कोई भी आई
इसको 2-2 कतरे दिन में 3 मरतबा दिया जाए. सीरियस बच्चा है, मुश्किल चांसेस लग रहा है इसके बचने का. एक ही दिन
I'm sure that if such things have happened in the West, in UK or in Belgium, and even one child had died as a result of poisoning due to this drug, there would have been such an uproar that the firm would have withdrawn the drug and banned it not only from Belgium, from the whole world. And this is precisely what I would like to see, because if they continue it in any formulation, it is going to kill many more children in the third world countries because of misuse or overuse. So I think the best thing is for all the governments to ban this drug and for the company itself to withdraw this drug from the market.
The Pakistan government and Johnson & Johnson agreed to withdraw Imodium drops from the 6th of March. 2 weeks later, doctors were still recommending it, and chemists still selling it.
मेरे बच्चे को डायरिया है
जी
तो आपकी दवाई इसके लिए दी क्या
एज कितनी है बच्चे की
10 महीने
10 महीने के बच्चे के लिए डॉक्टर्स ज़्यादातर रेकमेंड करते हैं इमोडियम ड्रॉप्स क्योंकि ये सेफेस्ट ड्रग है और डॉक्टर्स 10 छोटी एज के लिए ये रिकमेंड कर रहे हैं।
ये किस तरह देनी है
इसके डोज जो है इसके 10 महीने के बच्चे के लिए 5 ड्रॉप्स 3 times a day 5 drops
15 drops a day for a child below the recommended 1 year.
शाम 3 times TDS
एक दफा कितने दूंगी
5 कतरे इसी आप ऐसे करती 15-50
Johnson & Johnson have sent out letters of withdrawal to distributors and retailers. This one is dated April 15. But by late May, only 5 out of 100 chemists visited admitted receiving such letters. Kasim has now been here for 4 hours, but his condition is deteriorating.
करनी पड़ेगी Imodium drops are officially off the market in Pakistan. Elsewhere in the world, the company has imposed a 2-year age limit on their use. Johnson & Johnson declined to take part in this program.
The death of Qasim Youssef, aged 25 days, in one hospital in Multan. What nobody knows is how many deaths in how many countries over how many years. Professor Bhutto warned of the danger to children as long as the last bottle is on the shelves. But we heard last week that the company have now withdrawn Imodium drops from Italy and are in the process of withdrawal in the rest of the world. However, we were still able to buy Imodium drops in Karachi today. Until the first Tuesday in July, good night.